Ask Your Pharmacist Season 3 is proudly brought to you by Dragnet, the Pharmaceutical Society of Ghana, Let Up Pharmaceuticals, Chango, U School, and the Tema Christian Eye Center.
Hello everybody, welcome to another week of Ask Your Pharmacist. You would all agree with me that one of the most expensive things in life is good health. Yet it tends to be the one thing we disregard the most. And so I hope that by the end of today's discussion, you would understand the need to prioritize and put your health first. My name is Peggy Sanwo. You can find me on Twitter or Instagram at Fiery Peggy. If you missed any of our episodes, go on YouTube at My Pharmacist TV. Like, share, comment, and make sure you subscribe. You can equally follow us on Instagram at _Ask Your Pharmacist and on Facebook at Ask Your Pharmacist. Ask Your Pharmacist is proudly brought to you by Dragnet, the #1 online pharmacy. Download the app on the Google Play Store or the App Store. Speak to a pharmacist, upload your prescriptions wherever you are. Dragnet will deliver to you. The Pharmaceutical Society of Ghana. Amicus Humani Generis Pharmacists are indeed friends of the human race. Chango. Chango is your platform of trust. Chango keeps track of all donations and gives you the power to know exactly where your money goes. Download the Chango app on the Google Play Store or the App Store. Chango for your groups and crowdfunding. U School is the most comprehensive school management system, provides you with many services from student admission all the way through payment of school fees using a simple short code. Contact IT Consortium on 0559 497120 or email info@uschoolonline.com and start your journey to effective and efficient school management with us. Let Up Pharmaceuticals is here with Letamin. Letamin is a multivitamin and mineral supplement for total growth and vitality. Foliron Zinc is a folic acid, iron, and zinc supplement for iron deficiency. Letamox, your trusted and #1 dewormer for your whole family. Contact Let Up Pharmaceuticals on 030 222 4613. Tema Christian Eye Center. Tema Christian Eye Center is a comprehensive eye care facility with skilled and experienced doctors with exceptional customer service. Locate them at Tema Community 1, adjacent to St. Paul Methodist Church, or please contact them on 030 2211 999. Tema Christian Eye Center, changing lives through proper eye care. We are taking a quick breather. The show continues. Stay tuned.
When on campus and not well, I worry no more. Thanks to Dragnet. With the Dragnet app, I can chat with a pharmacist anytime for my medications, and they are delivered to me right here on campus.
I am a trader. If I need drugs, I cannot leave my goods and visit the pharmacy. All I need to do is click on the call feature on the Dragnet app and I speak with the pharmacist. The drugs are delivered to me right here. Dragnet, ahotoswo papa.
As a businessman, moving around to search for my medication could be very frustrating. But now, with the Dragnet app, I'm able to upload all my prescriptions and have them delivered to me wherever I am. The Dragnet app also allows me to order refills for my mother to treat her chronic illness. Dragnet delivers all the medications to her on time. It's so reliable and convenient. Download the Dragnet app from the Google Play Store or App Store. Dragnet, your #1 online pharmacy.
Araba, there are some people at the door. Go and tell them I have traveled to Russia.
Yes, Daddy.
Where's your father?
My father said I should tell you he has traveled to Russia.
Your father has killed me. I sent him money from America to complete my house for me.
Are all student association contributions?
Even the money from the fundraiser for Kweku surgery.
Oh! He too? Don't be a victim. If you're contributing to a project, alumni dues, or any public campaign, Chango is your best choice. Chango keeps track of all donations and gives you the power to know exactly where the money goes. Chango is approved by Bank of Ghana. Call 0270-066-614 or visit changoapp.com for more information.
Oh, Araba!
Chango for your groupings and crowdfunding.
Welcome from the break. You are watching your favorite health show, Ask Your Pharmacist. So today is the final episode on the liver series, and we are coming to you from the International Maritime Hospital here in Tema. We are discussing fatty liver disease with no other person than Pharm Dr. Magda Dorsey. He is the head of pharmaceutical services at the International Maritime Hospital. He's a cardiac and critical care specialist pharmacist and a fellow at the Ghana College of Pharmacists and a fellow elect of West Africa Postgraduate College of Pharmacists. He's also a member of the editorial team of the Standard Treatment Guidelines and a lecturer at multiple universities. Pharm, how are you doing today?
Doing well, and yourself?
I'm doing very well.
Thanks for having me on your show.
Well, I'm super happy we are actually ending, you with fatty liver disease, because you tend to be doing so much in the space, and we know that today's episode is going to be life-changing for our viewers.
It's an honor to be here.
Absolutely. Without wasting my time, let's go straight into the action for today. Fatty liver disease. What is that?
Fatty liver disease basically is a very common condition, which is anyone having too much fat buildup inside the liver.
Okay.
So in a nutshell, you have a lot of fat inside your body or inside the liver. But usually it's not a problem for us as individuals, but in a few people, when your fat percentage or the amount of fat reaches 5 to 10% of the body's weight or of the liver's weight, then it starts to create problems for you. So is it really bad? In most cases, you will not see any symptoms, or it doesn't cause any problems for most individuals. It doesn't quite prevent functioning of the liver until it reaches a really, really bad stage.
Okay.
But for about maybe up to 30% of the people, they may progress to maybe liver disease or even liver failure or cancer.
Is that to say that naturally the liver has fats around it?
Yes, so the liver has a certain amount of fat.
Okay.
So yes, every liver contains a certain amount of percentage of fat.
But excess of it
Excess of it, yes.
Sure.
So excessive fat buildup inside the liver is what causes the fatty liver disease. And the way it progresses to liver failure or cirrhosis, basically with the inflammation or with the swelling of the liver, it damages the liver tissue.
Okay.
And usually when that happens, it forms a scar.
Oh.
So depending on the extent of damage to the liver tissue, you may have a lot of scarring of the liver.
Wow.
And this becomes like hard scars that replace your healthy liver tissues. With time, and because of what the liver does, all its functions, when these scars replace the healthy liver tissue, it may actually block or prevent the liver from functioning properly.
Wow.
And then also may lead to what we call cirrhosis, and then possibly liver failure or liver cancer.
We will get to that, but do we have types of fatty liver disease?
Yes, so there are two common types that we know of. One is the alcoholic fatty liver disease, which is due to somebody's drinking excess amounts of alcohol.
What's your definition of excess?
So different global bodies define what excessive is.
Okay.
I know somebody that drinks a tot a day and eventually they still end up developing liver failure. And there are people who drink
like a whole bottle.
a whole bottle and they're still fine. So yes, but globally they say things like 2 to 3 drinks a day for males and 1 to 2 for a female.
Okay.
What one drink may differ depending on what type of jurisdiction you are. They also look at things like if you're drinking beer versus hard liquor,
Cognacs,
or like the hard stuff. So it all depends, but yeah, 2 to 3 drinks per day for men and 1 to 2 for women.
So that's for the alcoholic part of
so
the type.
in excess of that,
Okay.
in excess of 2 to 3 drinks per day can lead to problems for you in the future.
All right, so what's the other type then?
The other type is the non-alcoholic fatty liver disease, which is not due to alcohol consumption, but can be due to other facts. Typically, our clinicians are unable to find a true cause of it, but if you have diabetes or hypertension or high cholesterol, that typically can get you there.
So Doc, what are the risk factors of fatty liver disease?
So your chances of developing fatty liver disease are higher for our society as Africans, typically if you have other risks, so high blood pressure, diabetes, high lipids. So in lipids, I mean your high cholesterol, high LDL, low HDL, or total cholesterol is high. And then if you also have what we call obstructive sleep apnea, where your airways can be blocked, which can sometimes cause you to stop breathing at night when you sleep. So that can be a major risk factor. And then also for women who have completed menopause, so their periods have stopped. Yes, so they unfortunately have a higher risk of developing fatty liver disease. And then for the causes, there are so many things that can cause fatty liver disease. We've mentioned the alcohol and the non-alcoholic things, but if you're overweight, you're obese, a lot of fat around your waist area or your trunk area, or you have type 2 diabetes, what we call insulin resistance, so you're unable to utilize insulin properly to break down food when you take that in. Metabolic syndrome, high blood pressure, high cholesterol, high triglyceride levels. You take certain type of prescription medications that can also potentiate that, and other things.
Okay. So I tend to hear that Africans or blacks are more susceptible to getting fatty liver disease in this, globally. How true is that?
Not only Africans, but also, like you mentioned, globally. So Asians and Hispanics, so like the Mexicans, people in that area. Asians are also prone to it, together with Africans. But a lot depends on your environment, your geographical location, the way you live your life, and everything. Your risk, basically.
So it's not a black, kind of disease.
Yeah, and really globally, I think the incidence in black people is actually less than in Asians and Hispanics. So maybe we take one win.
Well, I'll take a win over nothing, yes.
Yes.
Okay, well, I'm glad to hear that, because we tend to hear that based on our diet, because, we like the chiches. Everything has to be deep fried, crusty, crispy. And so I think that's why most people tend to think that, black people or Africans tend to be more prone to getting fatty liver disease. So let's talk about clinical manifestation. How do you know that you have fatty liver disease?
So for most people, they may not experience any symptoms of fatty liver disease until they progress to what we call the cirrhosis of the liver, or the severe stage.
Okay.
And typical symptoms that you find in most people will include abdominal pain or stomach pain, stomach ache, a feeling of fullness, especially at the upper right side of the abdomen or your belly. Then that also can also add on to nausea, vomiting, loss of appetite, and then losing weight. So they lose weight, and then we hear things like, I don't know why I'm losing weight, and which in medical terms you call unexplained weight loss, until we do the test and find out that it's possibly the liver that is inflamed, or fatty liver or something like that. And severe stages, you start seeing the skin manifestations, so the yellowing of the skins and then the whites of the eyes, so called jaundice. And then patients may also experience a swollen abdomen, which is typically what we call ascites, fluid in the abdominal area, and then also edema in the legs, so swollen legs filled with water. You push on it, and then you notice it goes in and then comes back out. They may also experience extreme tiredness, and then in very, very severe cases, mental confusion, and then weakness. So these are quite severe symptoms.
Very severe.
You don't want to have.
Definitely. So if a person could be asymptomatic, then how then do you get to diagnose or determine that the person has fatty liver disease?
Only way to diagnose is to screen or test them. And there are different ways to test, or there are different things that we do to test these patients. So number one is to run a liver function tests, in addition to the patient history, taking their symptoms and complaints and how they feel. There's also something called a fibroscan, which you can do to check for fibrosis inside the liver. And then you can also do a CT scan or a liver ultrasound which checks, looks at pictures within the liver and then gives you a fair idea of if they have liver disease or not.
And these are readily available in many hospitals?
Yes, they are. Yes, especially the liver function tests. They are readily available.
Okay.
Yeah.
Alrighty now, so like you heard, you can always go to the hospital and get diagnosed or get, lab works to make sure that you are not prone to fatty liver disease. We are taking a quick break. We'll come back with more. Stay tuned.
Are you a proprietor seeking to notify parents on fees payments, arrears, and PTA meetings? Or are you the busy proprietor who needs an all-round anywhere access to your school and its administration? If you answered yes to any of these questions and more, then your problem is solved. USoft Solutions has the solution for you. USchool. USchool is a robust school management system which is tried and tested with over 8 years track record. USchool has rich modules for admissions, fees payment, fees billing, academic reports, journal ledger, messaging, petty cash, and many more. By dialing *789*800#, parents can pay fees directly to the school's bank account, receive SMS receipts for the payment, and a link to download electronic receipts in PDF. Our SMS model allows you to send unlimited SMS messages on fees payment, fees billing, student outstanding fees, and any other messages. All transactions and payments go through an audit and validation process so you know who collected what and when. With a single sign-up, you get to enjoy all these without any hidden charges. Call USoft Solutions today on 0559 497 120 or register at www.uschoolonline.com or email info@uschoolonline.com and have a stress-free school management. USoft Solutions, empowered to do more.
Yamamu Akwa Badeba Tema Christian Eye Center eye ini yaresabia Tema Christian Eye ini yaresabia yehwe ini yario bia efree nkolamu ekosi impenimfo so se efa nia ewose ma withdraw anase ne be operation anase se uhia space impo your dispensary fully functioning dispensary edro bia ehia wo se ewose edema na udigu weni so mane kon ubenye bi yedbema humbeto ni ehia se eye operation bia no ahanso ye ma se etire so kra na se laser na uhia eno so ye bu Tema Christian Eye Center ha ye ejuma fiti ejuada kopem memnenda aye Monday to Saturday ye wo Tema Committee 1 opposite Golden Chopstick Restaurant anase utumi bisase St. Paul's Methodist sorry no
Tema Christian Eye Center, changing lives through proper eye care.
Thank you for sticking with us. You are watching Ask Your Pharmacist. We are still discussing fatty liver disease with Dr. Mark Dradosi from the International Maritime Hospital. We left off talking about diagnosis. Now I would love for us to delve into the complications of fatty liver disease.
All right, so before I touch on the complications, I also wanted to mention that one of the other diagnostic tools we use is biopsy.
Okay.
Where we go into the liver with possibly a video-guided needle to take a small sample from the liver tissue and then take it to the lab to analyze.
Okay.
And then we determine determine what type of liver disease you have.
Sure.
In terms of complications, fatty liver disease can progress into cirrhosis.
Okay.
And then liver failure, liver cancer, and then also death in extreme cases. So that's why it's very important to check your liver, take the necessary things that you need to take to make sure that you are protected and you do not progress to liver failure.
All right, Doc. So now I want to find out, can fatty liver disease be treated?
Yes, it can be managed, but as in total elimination, it depends on how far it's gone or progressed. So there's typically no drug that has been approved per se or specifically to treat fatty liver disease.
Wow.
But there are, usually we manage it, we manage the condition. The best management strategy is to look at what has caused it.
Okay.
So if it is alcoholism, you manage the alcohol side. If you are obese or overweight, we manage the obesity. If you have diabetes, we look at that. If you have high lipids, high cholesterol and those things, we manage those. And usually when you manage them properly, you're able to resolve the condition, or at least reduce the effects, or you reduce the condition, prevent the condition from progressing to the liver failure or the liver cancer or the other serious complications of it. There are medications that can be used, as well as supplements that we used. One common one is the labeling that we see in front of us. There's also vitamin E that can be used, but it has to be recommended by a health professional. If you have diabetes, there are certain medicines that have been known to help people specifically who have diabetes and fatty liver disease. So there's definitely some help. The key thing is that you do not have to wait till deep or very far into the disease before you present for treatment. The other caution will be to make sure that things that are presented to you in terms of maybe herbal or other supplements that do not have very strong scientific or clinical backing to it, you avoid them, because some actually will end up making your condition worse. I mentioned some of the herbal supplements, even though they do work very well, if they do not have very strong clinical support, we've seen a lot of them leading to liver failure. So very necessary things. Clinicians should also make sure that before they even write a prescription for anything, they have checked the liver function.
Right. Well, I love the sound of that. Well, we all love the mantra that prevention is better than cure. How can we prevent fatty liver disease?
Manage the risk factors. You can also take supplements. Labeling is one of the options. But the key thing is take care of yourself, identify your risk early, and take measures to prevent fatty liver disease. So if you drink alcohol,
reduce that.
If you like eating the fried and deep fried and double fried, cut back. Actually, fat is very good for you as an individual, but excessive fat causes too much damage to our bodies, from the heart to the head, or let me say head to toe. Fat causes so much. Fat is actually a contributor to a lot of our current non-communicable diseases, from hypertension to the strokes, to eye problems, to heart attacks, to kidney issues, liver issues, blockages in the legs, blockages everywhere. So fat, as much as it's good, if we can grill, let's grill, not fried.
Okay. What would be your final words to our viewers?
It's Liver Month. Let's pamper our liver. But to pamper your liver means don't do things that are going to injure your liver and lead to liver failure. Thanks to everyone for teaming with us during this month, to Mega, to Ask Your Pharmacist team. Thanks for coming to my office.
It's always a pleasure.
So International Maritime is pleased to be part of this, and we wish everybody a safe liver health month. Continue to take care of yourself and live long.
Wow, I love the sound of that. Thank you so much for doing this with us, Doc. Pamper your liver. 1 month is not good enough for you to start taking care of it. Forever and for the rest of your life, you should always be conscious that your liver matters. Dose for Healthy Living is up next. Don't go anywhere.
You're welcome to today's episode of Dose for Healthy Living. My name is Carl. Today, I'll be interacting with Farm Nana Pema Akufo-Addo. Farm, you're welcome.
Thank you, Carl.
Right, Farm. So I want to find out from you, is it ever important for viewers to always make sure they purchase medication from pharmacies?
Thanks, Carl, for this question. Now, pharmacies and licensed chemical shops are the only two facilities that have been licensed by the Pharmacy Council, and are allowed to sell medications. You are assured of quality and safe medications when you purchase your drugs and medical products from these two facilities. You may not want to get medications from drug sellers on the streets, the lorry stations, the markets, because you're not assured of the quality and safety, and also these people have no knowledge on what they are selling to you. So you tend to endanger your own life when you purchase drugs from these drug peddlers. Okay. So if you have any question on medications, if you are not feeling fine, if you have any drug related need, I would advise you go and see your pharmacist. And every pharmacist is ever ready to be of help when it comes to medications.
Thank you. So viewers, we have been told that pharmacists are custodians of medications. And so anytime you need any medication advice, always ask your pharmacist. Thank you for watching this episode. See you next week.
And so viewers, this is the final episode on liver series. I hope you enjoyed all of it. You actually learned a lot. And if you want to refresh your memory, go on YouTube and My Pharmacist TV and make sure you like, you share, and you subscribe. You can also follow us on Instagram at _AskYourPharmacist and on Facebook at Ask Your Pharmacist. Ask Your Pharmacist was proudly brought to you by Dragnet, your #1 online pharmacy. Download the app on the Google Play Store or the App Store. Order all your medications. Speak to a pharmacist, and wherever you are, you can get it delivered to you. The Pharmaceutical Society of Ghana. Amicus Humani Generis pharmacists are indeed friends of the human race. Chango. Chango is your platform of trust. Chango keeps track of all donations and gives you the power to know exactly where your money goes. Download the app on the Google Play Store or the App Store. Chango for your groups and crowdfunding. U-School is the most comprehensive school management system. Provides you with many services from student admission all the way through payment of school fees using a simple short code. Contact IT Consortium on 0559 497120 or email info@uschoolonline.com and start your journey to effective and efficient school management with us. Let's have pharmaceuticals with Letamin. Letamin is a multivitamin and mineral supplement that provides you with total growth support and vitality. Foluron Zinc is a folic acid, iron, and zinc supplement for iron deficiency. Letamox is your trusted and #1 dewormer for your whole family. Contact Leta Pharmaceuticals for bulk purchases on 030-222-4613. Tema Christian Eye Center is a comprehensive eye care facility with skilled and exceptional doctors and top-notch customer service. Locate them at Tema Community 1, adjacent to St. Paul Methodist Church, or call them on 030-2211-999. Tema Christian Eye Center, changing lives through proper eye care. Like I always say, whatever that goes in you is merely irreversible. Always speak to your pharmacist before you swallow that pill. My name is Peggy Sano, and I'll be here same time next week. Be safe and be healthy. Bye-bye.
Ask Your Pharmacist Season 3 is proudly brought to you by Dragnet, the Pharmaceutical Society of Ghana, Let Up Pharmaceuticals, Chango, U-School, and the Tema Christian Eye Center.